good afternoon, and welcome to the Z Wellness Link. My name is Dr. Padiaite, and I'm your host. Today, we are talking about something special. This week happens to be, what's it? Glaucoma week. Yes. And we are taking advantage of that opportunity to talk about glaucoma. Our guest is Dr. Irene Antwi. She's the CEO and optometrist at Blackwood Optometry. They have a branch at East Legon on the Boundary Road, right?
Yes.
On the Boundary Road, and then Tema Community 3
and Osu.
And Osu, hey, Osu, come inside.
Oh yes.
Chale. and Osu. So Irene, you're welcome.
Thank you, Dr. Paddy.
I'm really grateful that you've come to share this time with us.
My pleasure.
For us to talk about this very, very, very important subject. So let's start. What exactly is glaucoma, and why is it a serious eye condition?
Okay, so glaucoma is one of the many eye diseases that do exist. And glaucoma comes as a result of inbuilt pressure in the eyeball, causing the nerves at the back of the eye to, it dies out, or there's damage to the nerves at the back of the eye.
Due to the pressure? Due to the pressure.
So I don't know if some people can see this eyeball here. Yes, so if this is the human eye, we can see all the nerves inside the eyeball.
Okay.
Yes, and all these nerves, they do gather and then they connect to the brain here.
At the back?
At the back
of the
there.
eye, okay.
Yes, so they are sending signals to the brain. So if these nerves, some of them are damaged, it means that the brain is not receiving any information.
The signal
and therefore,
does not get
exactly, you cannot see.
So it's like your DSTV signal has gone off.
It has gone off.
And then you can...
it's like your car headlights. Yes,
okay.
Yes, the wires have been cut. So it means that the light will not come on. It's not like the light is spoiled, but the cables are gone.
Yeah.
Yes, so that is glaucoma for you.
Pressure causing damage to nerves.
Yes.
And therefore, the eye can no longer... The image that the eye captures can no longer be transmitted to
the brain. Exactly.
And essentially blindness.
Exactly. So it's like if you have, let's say, you know the penny water we used to have in the rubber.
Which one?
The one they used to tie and sell.
That was before the hair.
When they tie it, it's like there's pressure in it.
Yeah.
So imagine that, and then you have straws in that rubber.
Okay.
And you keep pouring more water
inside.
What happens to the straw?
Okay.
The straw will start coming out. Or even if you have a bottle and you keep pouring more water,
it starts coming out
because of the pressure that is being built. So the same way with the eyeball, as the pressure increases, the nerves begin to die out gradually, and that is what is called glaucoma.
Is it a major cause of blindness?
It is actually the leading cause of irreversible blindness.
Irreversible?
Yes.
Kojoto?
To.
Gone. Hey. How common is it?
Glaucoma, it's quite common now, especially in Africans. Gradually, especially in Africans, and then if there's a family history, it is possible that it will run through the family. Yes. So in about Ghana, we are looking about a prevalence of about 6.8% thereabouts. Yes.
Of the Ghanaian population?
Of the Ghanaian population.
30 million times 6.8. That's a lot.
That's a lot.
That's a lot of people.
Yes. And most of them do not even know that they do have glaucoma.
So you mean you can have it and not know you have it?
Oh, most people do have glaucoma and they don't know.
It doesn't do anything to you?
It doesn't do anything to you.
You don't feel anything?
You don't feel anything
Headaches,
at all.
Eye pain?
Nothing.
Silent?
That is why, yes, glaucoma is very dangerous. The silent thief of sight.
That's what they call it?
Yes.
The silent thief of sight.
Mm-hmm.
So it's not that you feel like your eye is paining you or you're this...
No.
Hey, are you serious?
I'm very serious. I'm very, very serious. And I know that it's difficult to really accept.
No, so I mean you feel you are well.
Yes.
But yet you have a problem that is killing your sight.
Exactly. Because most people feel once I can see, my eyes are fine. You can see very well. Even, you know, the charts in the eye clinics. Yes. You can read 20/20, even 6, and even go to the much smaller numbers. Alphabet. You can still see, but you may be having glaucoma.
How about assumption?
So those people who keep saying that, hey, as for me, my eyes are good, though. I can see far.
You can see far, but it's still killing you.
Yes, It could be.
What is the cause?
That's another interesting thing. Glaucoma really doesn't have any particular cause.
There has to be a cause. Maybe we don't know.
Maybe we don't know.
There has to be something.
But for now, there's no known cause. There's no known cause.
Okay.
Yes, for glaucoma.
So how is it diagnosed? How do you find out if you have it?
Okay. So basically, it's through the eye screenings. Okay.
Okay.
So those who don't like checking their eyes, somebody say, "Oh, me, I'm about 40. I've never checked my eyes." Please, you have to check your eyes.
How often?
At least once a year. Because glaucoma, it doesn't start with any symptoms. It can only be diagnosed in the clinic by a doctor. You get it? So if you don't go for screening, we wouldn't know that you have glaucoma. And you yourself, you will not be able to tell because you don't have any symptoms. But when you come to the clinic and then we examine your eye, comprehensive eye examination, we're able to tell that you may have glaucoma. Then if we have to start managing it, we start managing it.
So how is the glaucoma, the tests for glaucoma actually done? That one in particular, how is it done? I know you have plenty of tests, but there's the glaucoma one. How is it done?
So the glaucoma one, normal, I know people have heard, check your eye pressure, eye pressure. So the first thing is to check your eye pressure. Okay. So those of you who have been going to the eye clinic and only getting glasses, it is not enough. It insists that you get your eye pressure checked. So when we check the eye pressure and it's a bit high, we give ourselves a range of about 10 to 21, saying that is the normal. And even that now there's a big question mark because we've had people within these ranges, but they still have glaucoma. Okay. You get it? So checking the pressure alone is not enough. But let's just say, if it is more than, exactly, if it is more than 21, we want to investigate further. So then that is when the scans come in, the OCT and the visual field test. All these things will come together to conclude that indeed this is glaucoma or not. Sometimes it could just be ocular hypertension, not necessarily glaucoma.
What's the difference?
So the ocular hypertension, the eye pressures may be high, but then it is not causing any damage to the nerves at the back of the eye. Okay. Maybe you're on some medication or there was some form of accident or you are sick or something. That could have caused the pressures in the eye to go high, but that doesn't mean that you have glaucoma. It could just be ocular hypertension. That can easily be treated with some eye drops, yes.
So it's like you have BP of the eye. Glaucoma is like you have BP. You have BP
you
of
have
the
BP
eye.
Of the eye. Yes.
Oh, okay. That's some way.
That's some way.
All right, so the test, but you didn't describe the test. How is the test done? Because
I know there's a particular machine that we use. It's called the tonometer. Okay. Some have experienced this puff that they are very scared of now. That even when it comes to the clinic, any machine you pick, they think is the air puff that is coming to them.
Why are they afraid of the puff?
Sorry?
Why are they afraid of the puff?
Because it comes like puff and it scares them. It's like an air is being blown into their eye.
But it's like if you open your eye to an AC and the AC is blowing air.
Exactly.
It's air.
So that one is there. And now there's one that's like, I wish I had brought mine. It's like, it's just a handheld thing. Okay. Very small pin. It touches your eye gently. So we just bring it very close to your eye. We shoot it to the center of your eye. It measures the pressure. Or...
So it touches the eyeball?
It touches, yes. That's the center, the cornea. Okay. You may not even feel it.
So there are two. One of them is it blows air.
Yes.
And then it uses its calculations to know how the air was reflected back to calculate the thing. And another one, you actually touch the eye. Yes. And then feel the pressure inside.
Exactly. Yes.
Whether it's medium rare or a rare stick. Okay.
Yes. And there's another one that is most effective one. The one that we put the dye on your eye. So sometimes when you go to the clinic, they put a dye. It looks yellow. Then they tell to put your head on it, and then they'll bring some machine.
Then they'll touch the eye.
Then they will turn something.
Okay.
Yeah, that one is very, very accurate. Okay. The aplanation.
But when you are doing those tests, you have to keep your eye open.
Oh yes, you have to keep the eye open. It's the eye we are checking.
If I want to blink,
you can't blink. At that point,
I shouldn't blink.
Hey, sometimes you can spend more than an hour
trying to get somebody.
No matter the anesthesia you have put on the eye, still
they are blinking.
Once they know that something is coming to the eye, the eyes are so sensitive.
They'll close the eye.
They'll close the eye. You can spend 2 hours cry. You can't check.
But if you have got something that you can fix on the eye and open the eye.
Normally,
that used for surgery.
Those ones are used for surgeries, yes.
You can't use it for the test. If the person refuses to stop blinking.
Maybe we'll have to consider that for those people, yes.
Okay, so that is how we do the test.
Yes.
And that is how we get to know
So that is to measure the eye pressure.
The eye pressure.
So if we think that the eye pressure is high, mind you can't just conclude that somebody has glaucoma just and not even once. You can't test once and say, it's glaucoma. So even the eye pressure, have to check it like 3 times. If it's consistently high, then we have to do the scans as well, the OCT and then the visual field test.
So I'll get to that
very soon.
In a few minutes.
Sure.
Ladies and gentlemen, this is the Z Wellness Link. We are talking about how to prevent and manage glaucoma. Our guest is Dr. Irene Antwi from the Blackwood Optometry, East Legon, Tema Community 3, and Osu. Please stay. We'll be right back. We shall take a short break, and our song is The Miracle Working God by Team Eternity.
Z 101.9 FM.
Nothing he can't do. So take it to the Lord in prayer. I'm telling you, he can do it. Oh, you're burning. He can do it. Oh, you're stuck down. He can do it. Take it to the Lord. He can do it. He's got power. So much power. Oh, he can do it. Oh, you're broken. He can do it. Take it to the Lord. He can do it. He's gonna do it for you. So much power. So
And this is our discussion on how to prevent and manage glaucoma. Irene,
Yes,
how
Doc.
are you? This one, you were telling us some stuff about how we should, the other tests. So you've
Yes.
done the pressures. Pressures have been assessed.
Mm-hmm.
The pressures are elevated.
Yes.
So we think, therefore, there are more things that we need to do. What next?
Okay, so those whose pressures are consistently high, then you have to do the visual field test and the OCT scan. So the visual field test, normally the machine is like a field. It's a round field, 360 degrees field.
Okay.
So you put your head in there,
Mm-hmm.
and then a target of lights would be shown. Then they'll give you a knob that you need
Okay.
to press.
Press.
So the lights that you see would be appearing at different areas in the field.
No,
So
hold on,
anytime,
hold on, no. Let me ask this. So they give you a knob, and then the to press,
yes,
and then the light will be
yes,
shooting,
yes, at different
At different
brightness
brightness,
and different angles.
locations.
Yes,
and you close one eye, or you close.
we would normally cover it for you. We
you,
put
so you
like
cover one eye,
you pirate.
so you become a pirate. So one eye is covered,
Yes,
and then you are looking, and they are firing the shot,
yes,
and you have to identify
yes.
whether it is a panenka or it is a left down, right
Yes.
down, left
And
up.
then we will give you a target in the
Okay.
center of the field. You're
Okay.
not supposed to move your eye from the target.
You must be looking.
You see
straight
when
at
you
the
are
ball.
watching TV,
Uh,
and sometimes a mosquito comes to you haven't turned your head,
Yeah,
but you
but
can tell
yes,
that
yes.
but that is the kind of test we do.
okay.
Yes.
Okay.
So
I
anytime you
understand.
see that light, then you press.
You press.
So it measures how well you can see your peripheral vision is.
So somebody they can do it and you see anything.
You finish and then you print out and everything is black.
Scores when you be.
When you be
Feel.
advanced.
Oh, right there.
Yeah, you're advanced.
So that person can't watch La Superadora.
Rosalinda.
Rosalind, you can't see.
Yes.
Oh. It needs to so spare. There's no-
Sometimes too.
Are we doing eye transplants?
I haven't heard of eye transplant yet. Cornea transplant, yes.
So I'm
But the
thinking,
entire eye.
the eye is not good. You change the eye.
Oh, we said this one is the nerve. So the glaucoma is the nerves. How to get the nerves to regenerate,
That's the problem.
like the brain cells.
Mm.
That's the problem. Once it's gone, it's gone. So if the nerves that help you to see, like your peripheral vision, they are dead, it means that all those places. So sometimes you do the VFT, and when you print, I see that all these side, the peripheral side, is all black, but the central vision
It's
is
still
intact.
Okay. Now let's see how we can detect this early. Who are the main people who should be testing?
Family history.
So if anybody in your family has got glaucoma, you should be testing.
And most people, you remember, most people can say, oh, my great-grandmother got blind. I think it's old age. I believe now that what we thought was old age that was causing the blindness, maybe,
It's either cataract
or glaucoma. So normally in my clinic, when I'm taking history, I always ask, do you know of any grandparents who went blind in their old age? Immediately you say yes, I said, okay, then I have to investigate further.
Okay.
Yes, so
Because that could be the
yes,
case.
that could be
So basically history. Apart
history
from
and being
family
an
history.
African.
And being an African.
Yes.
African. Being an African increased number of twins, increased number of fibroids, and now increased number of glaucoma.
So what should we do, Doc?
We should become a brony. All right. So that is it. So it's hereditary, therefore.
Oh yes, it is hereditary. Yes.
At what age should we start screening?
Normally after 40.
Normally
Though
after 40.
yes.
But it can occur in young children.
Oh
right?
yes, there is actually juvenile glaucoma, congenital glaucoma.
Years ago,
Yeah.
years ago, a Ghanaian, well, I was in secondary school, and a Ghanaian couple came to stay with us. We're not in Ghana, and they had a child that they came from another state to
Okay.
where we were, and they had a child that had very, very poor eyesight.
Okay.
And I think she had juvenile glaucoma.
Yeah.
She wore some very thick Coke bottle glasses, even at that age, about 6. And they came to the eye clinic in our town, which was pretty well renowned. But I remember that child being so young and yet needing that level of care just
Yes.
because.
Yeah. But you mentioned glasses. I think it's also worth mentioning that we don't treat glaucoma with glasses. People
Aha.
should know.
Okay.
That is the reason why when you go in for glasses, don't just take the glasses and go away.
Use the opportunity and check
To
your
check.
pressure.
You cannot manage or treat glaucoma with glasses. Glaucoma is a pathology.
Very good point.
Glasses is a refractive issue. So they are two different things. Yes.
So routine checks from the age of 40.
Yes.
How often?
Once a year.
At least once a year.
At least once a year.
So visit your eye doctor once a year.
Yes.
Visit your dentist
Mhm.
twice a year.
Mm-hmm.
Okay.
And those who are also on steroid for long term.
Steroids. Okay.
Yes.
Okay.
For long term.
Yeah.
It can also
Autoimmune
induce.
people
Yes.
who are on those kinds of
Yes.
medications. Okay.
Mhm. So they have to be monitored carefully. And even sometimes trauma.
Like
Some
what?
people can have accident, hit their head, immediately they'll lose their vision. The pressure just shoots up, the nerves are gone. We've seen such cases.
Is there anything we can do to actually prevent it in our normal day-to-day lives?
If it had the cause, if it had a known cause, if it was like, malaria is caused by mosquitoes,
Yes,
so
you go for the mosquito.
But this one has no cause, so what can you do? Or will you disconnect yourself from your family history? It is not possible. So really, there is nothing.
Okay. We have to find the cause, then we can
We
find
have
what to do to stop.
exactly. Finding the cause will help us know some of these things.
All right. So, for those that we have not been able to prevent,
Mm-hmm.
but due to screening, we've
Yes.
been able to identify it.
Yes.
What treatments options are available?
Okay. So basically, there are two: the medication, the eye drops,
Mhm.
and then surgery.
Okay.
If it's detected earlier and the damage hasn't set in yet, we manage with eye drops.
Okay.
Maybe their pressures are not too high. Somebody can their pressures are 30 something, 40 something.
40.
Yes.
40.
Then you are shocked that this person is actually
Walking about.
Driving. Like a truck driver or some truck driver
With pressures of 40.
carrying people.
Going blind by the day.
So those people, we put them on. For that high pressure, we have to bring the pressure down ASAP.
Okay.
So we give them the eye drops
Okay.
to reduce it.
1 or 2 or 3 different
It
drops.
depends. Some are actually on 4 different.
Drops.
Yes.
Just to bring it down.
And keep it.
Down.
Yes. So I think I should mention that there are fluids being produced in the eyeball, carrying nutrients. So it's supposed to go through a cycle.
Mm-hmm.
It's being produced, go through a drainage system. It comes out like that.
Mm-hmm.
So two things: either you are overproducing the fluid,
Okay.
or your drainage system is poor, so there is no proper circulation.
Okay.
Either one of them can cause the pressure to be built in the eyeball. Okay, so when we are managing it, we are trying to target these two things: the production and the drainage system.
Okay.
I hope you understand.
Mm-hmm.
So that there's no pressure. So that's what the eye drops they do actually. But you have individuals, and once you're diagnosed with glaucoma, it means that the rest of your life you are going to be on these eye drops like
Okay.
forever,
Okay.
every single day,
Just to manage that.
just to manage it. So imagine you are 40 years and you've been diagnosed with glaucoma, and you are going to live to like 90 or 100. So you have like 60 years of eye
Okay.
drops,
Of eye drops.
which is not.
Get used to it.
Yes, and people, they just get tired. People, whatever, they won't use it. So then we go for the other option, the surgery.
Okay. What is done in the surgery?
So it's called a trabecular mesh. They create like a shank somewhere in the eye to help to the drainage system, so that the fluid
So that the fluid can flow.
flow properly.
It's like they put
Yes.
a small hole,
A
a small pipe
yes,
to allow fluid
yes,
to flow from one end
yes,
to another.
Yes, that's what
Okay.
they do. So that's the pressure comes, and even with those people, you don't leave them alone and say, "Oh, you have done the surgery, so just go and say no more."
You have to still be
You
monitoring
still have to
them
monitor them.
and then give them drops if necessary.
Yes, if necessary, because once they have the glaucoma, they have the glaucoma,
Okay.
and you can't just let them loose.
No, it's some way. It's some way.
Yes.
So, which people are the type that we do surgeries for?
So if your pressures are very, very high,
Mm-hmm.
and also you are not complying to your
Complying with your drug.
your drugs, you bet you what to who's because some people can go, they can like, doc, last year when I came again, I haven't bought. Then your heart is beating, but then again, because they can see,
There's no pain.
there's no
And
pain.
they can still see.
They can still see. So what you are saying,
They don't
They
feel
don't-
that, Charlie.
There's something wrong.
So, is there any like lifestyle change that they should that we can? You've told me, okay. Is there any food that we should stop eating? Is there any lifestyle we should change?
Dog, I'm laughing because the thing that when you lifestyle. Well, the normal things, you have to avoid smoking.
Okay.
Avoid steroids.
Okay.
If possible. Manage your sugars, your BPs.
Have they seen a link between glaucoma and diabetes?
Not necessarily. But then there's what we call the retinopathies.
From diabetes.
Yes.
That's a different condition.
Yes, that's a different. But part of the risk factors of glaucoma, we mentioned diabetes and hypertension.
Okay.
And you know, all those things normally happen after 40. The 40, above 40 groups.
Sorry.
Yes. And eat well.
They say life begins at 40. They didn't tell you that diseases also begin at 40.
And eat well.
Wow. So, he said food, no hope there. Lifestyle change, a few you've mentioned. There's prolonged screen time make you at increased risk of glaucoma.
I don't think there's a direct link. Prolonged screen time causes digital strain, but not directly connected to the glaucoma. If you have advanced glaucoma that you've lost some vision already, you already have a blurred vision. Prolonged screen time causes more dryness and blurry vision. That may affect it, but there's no direct link to say that, because you've been on the computer for so long, you have glaucoma. No.
So screen time. Yes, but there's something that I also know. Reading in a dark room.
Would it cause glaucoma?
No, it makes it worse.
I don't think so.
So I was told that if, for instance, like if we are in this room, there's plenty of light. So because there's plenty of light, my pupils will contract.
Yes.
Is that right?
Yes.
And that allows better drainage.
Okay.
Yes?
Okay.
Or something like that. Okay, I think so. And if we are in a dark room, and then you have some very small, the pupils will dilate.
Yes.
Which would worsen drainage.
Okay.
So if you like reading
in the
dark with some small light,
I'll go and research on that.
Under your blanket or something, it would cause your pupils to be wider than they should be, and the result is that you would have.
So anything connected to increasing the pressure in the eyeball, yes, habits,
can make it worse.
Can make it worse.
Asami, easy. Okay, so those who have glaucoma, what challenges do they face in their day-to-day life?
So the advanced ones, the early ones, they don't even
know. They don't feel anything.
But the advanced one, sometimes the peripheral vision is lost. So when they see a billboard, they may see just the middle part, then the edges are gone. Or even when they are watching TV, they can just see the middle parts. And sometimes they will see halos around lights.
Okay.
Yeah, and sometimes difficulty driving.
So if you look at the light and you see a halo around it,
yes,
you know that.
Yes.
You have some.
You may have some.
Okay.
Because there are other eye conditions that can also cause that as well, like cataract.
Maybe when you see the halo around somebody, it's
angels.
It's an angel. It's not an angel. They need an angel. Okay, how does it affect their daily life?
Yes, so productivity at work. So if part of your vision is gone, definitely
it's going to affect
your ability to work. Or then you may be limited when it comes to driving.
Okay.
Doc, I tell you, the number of drivers in Ghana driving with just their central vision. So imagine if you are driving, have advanced glaucoma, and your peripheral vision is gone.
Okay.
When a motorbike, a bicycle,
is coming,
those are the things that causes accidents on our roads.
So
but they will tell you that they've been driving for 50 years. They can't see.
That is what they used to do, not now.
But it's and sometimes.
So right now we have to look left, look right. You have to be more look left, look right, look left again, look right again, and look left again before you.
A lot of drivers, their peripheral vision is gone. Those who have glaucoma. Yes, and it causes a lot of accidents on the roads. Because somebody has done overtaking, you won't be able to tell. that somebody is even, or even when somebody is crossing the road,
Okay.
you can't see because
Okay.
you've
That
lost.
side is.
Yes, it's gone.
Okay. All right. You've answered quite a number of my questions, but I'm coming down to what are some of the myths that people have about glaucoma, which are not true?
That's glaucoma is
Like spiritual. This our country, everything is spiritual.
Glaucoma is spiritual. Glaucoma is treatable. Oh, I know some herbalists that can help you. Whoever says glaucoma is not, that one is there.
Okay.
Yes, so spiritual and it's being curable when it is not. And some people think, oh, glaucoma is cataract. They are two different things.
Yeah.
They are-
What is a cataract? Let's make our viewers.
So
like,
cataract,
understand.
there's a natural lens in the eyeball.
Okay.
Okay, and it's also filled with some
Where's
fluid.
The lens?
Here.
The lens? Okay.
So the lens sits behind. I don't know if the viewers can see. Oh,
It needs to come forward. Let it come towards me a bit more. No, down. Okay, down. We'll be closer to you. Closer to you. Okay.
Okay.
We are at the end of the table, so you can't do it much further. Put it on your lap. Will that work?
let me see. If okay,
Yeah.
this works.
Okay.
Okay, this works.
All right.
Okay, so we have this first layer. That's the cornea. It's a thin, transparent film that covers the eye. Okay, and then behind the cornea is what we call the iris. That's the colored parts of the human eye.
No, that
Mostly
is-
Africans.
It's black.
Yes.
Or brown.
Or brown.
In Africans.
Yes, but in Europe they have different
Blue
colors.
and-
Yes, and in the middle of the iris is what we call the pupil.
Okay.
That's the hole that you see.
Okay.
Then this natural lens comes in, so it sits behind the iris like that.
Okay.
So this is also filled with clear fluid. Now, sometimes as you age, the fluid in the natural lens part of it begin to solidify.
Okay.
Yes, so it forms solid substance in the eye,
Okay.
preventing light,
From getting through.
and it can form anywhere. Sometimes also at the periphery, sometimes at the center. Normally, if it's at the center, then it means it's blocking almost all the light entering your eye, so it becomes difficult to see. Some people's are formed around here. They can still see a bit because the central part is still clear. So that is, so when the natural lens becomes opaque, that is what we call cataract,
Okay.
locally called ete.
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 Okay.
Yes. And with this, surgically can be removed and an artificial one can be implanted there. It will sit there nicely.
And you can see again.
And you can see again. So at least it's
Please,
reversible.
the lens, the artificial one, can they make it progressives? The artificial, or can they make it bifocal?
No,
Or progressive? Oh, but you why?
you have to wear the
No,
glasses.
you start
I know
wearing
you want to
glasses.
run away from
When
glasses.
they change it, then they should put lens in. The lens inside, they put power inside.
They can do one. Either you would be able to see far without glasses, but you have to read with glasses, or you read without glasses, but you need glasses to see far. Choose one.
They can't do
They
progressive half
can,
and half.
no,
Only her.
no.
Only line in two fin so that the top part.
It's- Darby. So those are the different things. So because sometimes you have a patient, as you are taking the history, they know they've been diagnosed with glaucoma, but then they'll be mentioning cataract. Then you, the doctor, you think they have, but really they are talking about glaucoma.
Okay.
But they are two different things.
Yeah.
So cataract is like you have your windscreen is cloudy.
Yeah.
Let me put it that. That is what helps my patients to know the difference. Your windscreen is cloudy.
Okay.
Glaucoma is the wires connecting to your headlight has been cut.
Okay.
So you can. So those are the two different things. Yes, both make it difficult to see. But
One is easily fixed. which is the
exactly,
cataract,
yes,
but the glaucoma, if it's gone, it's gone.
it's gone. Maybe miracle.
Okay. So assuming you have glaucoma, you're on treatment, your visual fields are good, you can see, you can drive, not a
Yes.
problem.
Yes.
It is when you delay in treatment that it gets
Yes,
damaged and then
yes,
it becomes
Yes.
your vision.
I think the most important part is diagnosing it. You coming in early for it to be diagnosed. Once it's diagnosed early, you can live your entire life
without any issue.
without any but on drops.
So anybody who is Ghanaian
Mm-hmm.
and you are above the age of 40
Yes.
is at risk of having glaucoma.
Yes.
We are laying down facts now.
Yes. Yes.
Anybody who is Ghanaian
Mm-hmm.
and is above the age of 40
Mm-hmm.
should have his or her eye pressures tested every year,
Every year, at
least once.
Yes.
And it's not just a glasses test; it is vision test. Can
That
you
part
read?
is very important
It
to me.
is measure your pressures.
Or do a comprehensive eye examination.
So the recommendation is once a year,
Mm-hmm.
comprehensive eye examination.
Doc, because you know that through examination we have identified people who have diabetes that they didn't even
Yes.
know,
Okay.
and hypertension,
Okay.
cholesterol.
You
So
can
many.
notice all those things in the eye.
Yes. Yes.
So you can identify somebody who has diabetes by looking in the eye.
Yes.
Hypertension by
yes.
looking in the eye.
Yes.
Hyperlipidemia, excess cholesterol by
yes.
looking in the eye.
Yes.
Glaucoma by looking in the eye.
Mm-hmm.
Cataract by looking in the eye. Okay, is a window
Yeah,
to is
To
win,
the,
is
you
the
see, the
window
Bible
to,
said it to their soul.
to the soul.
Everything is there.
So if we regularly check our eyes, it will result in checking a lot of things.
A
Because when
lot
we
of
talk about
things.
medical examinations and we say, oh, every year go for checkup, we don't make the eye like
At all.
check your eye.
Yes. At all.
You're thinking of the prostate,
Ye-
not realizing the fact
exactly.
that the eye risk is higher than the prostate
Mhm.
risk.
Yeah. Imagine you being able to see and then suddenly you wake up and
So can it be you can see today and tomorrow you can't see at all?
yes.
Hey, like that.
Yes.
Doom so like that. I mean,
Doing
nothing.
so, yes.
Doom, this
It
one is doom. There's
happens.
no so.
The sudden loss of vision sometimes can be due to the diabetes, especially those who don't know. They can just go, the vision can just go off. It means that their pressures or their sugar levels have gone so high. But with them, once the sugar is managed or the BP is being
They
able
can
to,
see.
they can. Praying that we don't have a lot of damage in the eye,
Yeah, especially to the nerve.
especially because sometimes when the sugars are so high, there's should I say bleeding, hemorrhages in the vitreous,
There's that one give
Because
the cotton wool
the
thing, sir.
cotton wool spots.
So it's like you are seeing cotton wool swimming in front of your face.
So there's no, that one I think you're referring to floaters.
Okay.
Floaters is also, you get that a lot. Suddenly then it's like
Something's
cobweb
passing,
is
B.
like moving, B
Uh-huh.
is moving. This collection of fluid that you see, the vitreous sometimes too can have those parts being solidified. So they keep swimming.
Can't we do dialysis of the water inside in the eye? But we do dialysis of the blood for kidney. You can't do dialysis of the eye.
Not yet.
How can we wash the eye?
Hey, doc. Not yet.
Say why you feel it has to be washed.
Yet to me. So normally with those the vessels that are leaking into the vitreous, they can do laser to help block.
Bend those
Yes,
those-
bend.
So the
those.
laser will go through the pupil
Yes, it goes to the people.
and get to the spot.
Yes.
And
So
then
normally they dilate
the people
the
to make
people.
it very wide.
Yes, so that they can do that. Yeah, some more.
You think we should be making more noise about glaucoma? We think we should be.
Yes.
We should be. How should we do it
Making more noise about glaucoma.
for people to know about it? I mean,
We are making
How can we get more people tested annually?
annually. I think it also comes to the costs involved. If we can have organizations, maybe the government, hospitals, can make at least some of these tests free. The other thing that I needed to mention, glaucoma drops are very expensive. And the bottle is also very, very small. For example, if you have to do an OCT, you wouldn't spend less than 300 cedis to do an OCT. VFT will cost you about 150 cedis or more,
Okay.
plus the other consultation.
But if it just precious,
So if it is, well, when you enter an eye clinic, definitely you have to pay for consultation. But if we can have organizations that can offer free eye screenings, we take our things to the markets, screen everybody for free at least. For Blackwood, we do that. I know that some of my colleagues too are also doing that. So maybe government can empower the health workers at least to be doing that once a year or
we
every
don't
quarter.
have eye pressure measurements on the health insurance, do we?
I don't think
You
so.
don't? I don't know. I don't
I'm
know.
not sure. I'm not sure. And I think we as a people to have to renew our minds. Because
That's one of the things that I've come to realize. You see, this body,
mm-hmm.
that's the one that makes the money. This body,
Yes.
that's the one that does the work, that makes the money. If you don't use the money to maintain this body,
Mhm.
and the body collapses,
Mhm.
you suffer pain.
Yes.
You won't make any money,
Money.
too, because the body is
Mhm.
not working.
Mhm.
So I think even as you have an obligation to yourself
Mm-hmm.
to spend some of the money you are making on making sure that the machine is working the way it should work,
Yes.
so they can work for a long time.
Yes. Yes.
Because too many times people just don't pay enough attention
Not at
to.
all. Not at all. And I've been to so many organizations to talk about this glaucoma, and even whilst you are talking about it, they are even thinking something. They just can't accept the fact that we are saying that glaucoma is not treatable. It's not curable, and the fact that I see well, you are telling me that
You have a problem. Like you'll be blind in future.
in future, and because the damage, it would take a very long time before you begin to see that you can't see, so people take it very lightly. Unfortunately, if you come in and the damage is advanced, whatever vision you brought in, if you are left with 20%, 30%, 40% of your vision, that is what we will try
And
to
maintain.
keep and maintain.
But you can't get
What
it back.
is gone is gone. We, no matter the surgery, no matter the eye drops, we can't bring what is gone back. That is what makes glaucoma very dangerous.
Ladies and gentlemen, I beg you, every single person under the sound of my voice, please go and get your eye pressures checked. I think it's a critical
Yes.
thing. Get your pressures checked. Let us be sure that your eyes are in good shape so that we can make progress on things that can go. Because this one, dear, it is very serious.
Yes.
Hey, so
And when you are diagnosed with glaucoma, we advise that you tell your family members,
to get
your
tested.
children,
Yeah.
your siblings, everybody should get screened. If you don't have it, hallelujah. Even if you have it, it's still hallelujah. Because
you
once
got
it
it early.
detected earlier,
Yeah.
we can manage it and you'll be fine.
All right. I have a quick question for you. Someone is asking, does the eye have allergies?
The
And,
eye.
I know this is not a glaucoma question, but can you have allergies of the eye?
Yes, you can, especially. So most of the time when the eye is itching, it's due to an allergic reaction.
So itchy eyes.
Itchy
tend
eyes
to
are
be-
allergic. Yes, you have to find out what you are allergic to
Okay.
and then stay away from, because especially in children, we have a lot of children coming with allergic conjunctivitis.
Yeah. Some of them come and
They rub
they rub their eyes out that
Yeah,
here is
black,
black,
yes.
black in that.
Yes,
I've seen
yes.
some of those.
and the
those
parents get really frustrated. There's the thing about allergies or allergic conjunctivitis. You give them the drops, it will bring it down. But
Yes.
when they get exposed to the allergen, it
will
will come back. So I advise parents, find what is causing the reaction.
Find the insult,
Yes.
and deal with it. Because once that is gone,
But until you're able to find it, we will keep managing, treating it. Anytime the reaction starts, we need to put drops on it.
Okay.
It is the excessive rubbing over a long period of time that you see that black, and it results in refractive error and infections because they are touching things around and they are taking it to their eye because the eye is itchy. So they come in with itchy, infected eyes all the time.
well, I hope we've answered your question about the
Itchy.
the itchy.
Or the
The
allergy
itchy
is.
eyes. Dr. Irene Antwi, Blackwood Optometry, East Legon, Temacom T3, Osu.
Yes.
When are we doing Kumasi?
Very, very soon. When you say go,
We shall go.
we shall go.
Thank you very much for coming to share your knowledge with us. We really appreciate the
welcome.
time and the efforts that you have made and the information that you've given us. If there's one thing we are taking away today is all of us need to go and check our pressures at least once a year.
Yes.
And if the pressures are elevated, do more.
Yes.
Knowing how irreversible the damage is, it means we should all ensure that, hey, the earlier you screen, the better, and you must be consistent in checking. I always tell people that whenever your birthday is coming up, that month, check your body.
Yeah.
Use that as your body maintenance month. Check your blood pressures, check your kidney function, check your eyes, check your teeth. Just check your entire body. You're present to yourself,
Yes.
so that you would live a long and healthy life free of fear and panic. We are most grateful to you for your time, and
You're
I'm grateful to
welcome.
you, our dear listeners, for joining us on this program. Next week, we shall have another very interesting topic. Thank you very much.
Thank you.
This has been the
too.
Z Wellness Link. Take care and God bless. See you next week. Bye bye.
Z 101.9 FM.
Therefore, I love him, love you today. Heaven is how you shower.